When it comes to broken marriages, I tend to find two main categories of partners that seek therapy. The first category is of partners who are genuinely willing to understand themselves so that they can improve themselves and go back to their marriage and repair what's broken. In this category of partners, I tend to find them very patient because they are aware that the problems in their marriage have been going on for 2 years, for 5 years, for 10 years. And so 1, 5, 10 therapy sessions may not be enough to resolve all of their problems. They're also very committed to the process of therapy, which involves a lot of inconvenience, a lot of discomfort, a lot of pain, a lot of hurt. They're willing to endure that because they're willing to know themselves, to understand the version of themselves that broke that marriage. You see, when they come into therapy, they've reached a juncture between the person they were that they no longer want to be, and so that's why they're coming to therapy, to understand that person and to stop being that person so they can become the desired person that is going to have a healthier marriage, a better relationship, a happier relationship with their spouse. And so they're very intentional about this process because it's not just for their spouse, it's not just for their partner, it's for themselves too. They want a happier relationship and they're willing to put in the time, to put in the effort, to invest on themselves to be able to get that desired life that they want. And so in this category of partners, you'll find that they're willing to endure this process of examining themselves. What did I do, what did I say intentionally to hurt my partner that led to breaking this marriage? What did I not do, maybe unintentionally, that also hurt my partner? And how do I take responsibility for that? How do I help my partner nurse that wound back to health? How do I heal these wounds in the marriage to be able to now, restore the integrity of our marriage, to have our happiness back? And so in this category of partners, because of their commitment, they're not looking for excuses. They're not looking for justification. They're not looking for you to label their misbehavior as a symptom of an illness so they can get away with it. No, they're very willing to take accountability. And for them, by the time that they're ending this process of therapy or in the course of the therapy sessions, you'll find that they're seeing an improvement in the way that they relate to their spouse because they're applying the tools that they're learning in the therapy session to improve their relationship. This is the first category of partners. The second category of partners, they're coming in to prove to their spouse that this is how much they're willing to do to not lose the relationship. So it's a desperate attempt, and it's usually a show, a facade for their spouse. Like, this is how much I'm willing to sacrifice to not lose this relationship. And they don't seem to have a problem going back to a broken marriage. They don't seem to have a problem going back to a marriage where they're unhappy. And so the only reason they're coming to therapy is to show their partner what they're willing to do to not lose the relationship. And I find this second category of partners very impatient. They expect the problems in their marriage to be sorted out in one session or in 2 sessions. And I also find that they're looking for ways to justify their behavior, to explain their behavior. So, something happened in my childhood, a traumatic event that is, making me have this anger towards my partner, that is making me have this hatred or this feeling inferior towards my partner or doubting myself. And so they're looking for something that is going to explain their symptoms. So they're not really intentionally looking to understand themselves. They're looking to see, what can I use to absolve me from responsibility or taking any accountability that I don't have to fix, that can allow me to have my marriage without losing it. And so when you're working with the second category of partners, you might find yourself conflicted, especially as a therapist, because your job is to try and restore or replenish, broken resources, compromised resources in this individual, so that they can be able to go back and deal with their life challenge on their own. Yours is to provide them with the tools, right? But this person does not want you to provide them with the tools. They want you to actually do the work for them. So they want you to make sense of, their brokenness, that can allow maybe perhaps their spouse to understand what was going on, and maybe extend sympathy, so that they can go back to a broken marriage and have no intention at all to make it better. And so in this category of patients, of partner stories, you might find that they're looking for a diagnosis that can explain their, let's say, difficulty with intimacy, that can explain their resentment, their bitterness. They're looking for a mental illness, that can do that for them. And like I said, for a therapist or a psychiatrist, your job is to see if there is a diagnosis to make. If there isn't one, then you can't make one. But this person might try to push you to provide a justification for their behavior. And then you might find yourself really conflicted there. And I think a good psychiatrist or a good therapist should be able to have the ability to discern the intention behind the therapy being sought by the partner, so that they can know if they can help this person or how far they can help this person. Because the risk here is you become complicit in helping this partner dupe their spouse, or lie to their spouse that they're coming in to do the work, when really it's just a show. They're coming in to just be seen that they're doing the work without actually doing the work, and then they're going back to cause the same erosion, to destroy an already broken marriage. And so if the other spouse, let's say, agrees to stay in the marriage because their partner is getting therapy, and then something bad happens, then the therapist becomes complicit to that process. And that's why I'm saying it then becomes really important for the therapist to be able to identify as clearly as possible the intention of the partner seeking therapy as a way to improve themselves, so that they can fix what's broken in their marriage, or as a way to prove themselves so that they don't lose their partner in the marriage. It's really important.